Hi, good morning Theodore. My name is Haley Collin. I'm your invigilator for the OET speaking session on the 17th of February 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Theodore Vincent.
And what is your candidate number, please?
My candidate number is 233822107.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How would you handle if a patient refuses care?
If a patient refuses care, first, I'd find out why the patient denies. I'd take the time to talk to them, to make sure they realize I'm there to help them, and that I only want what's best for them. I've found that treating people with respect and dignity goes a long way in earning trust. Once they trust you, they will listen to you.
What do you do when entering a patient's room?
First, I knock to let the patient know I'm at the door. Initially, I'd introduce myself and try to find something in common with the patient, so that we can get to know each other. I always greet the patient and ask if they need anything, even if they aren't capable of responding.
What do you do to take care of your health, so you can show up to your assigned nursing shifts?
Maintaining health is critical in this profession. I need to be at my best when administering care to other people. I do this by eating well, getting enough sleep, and exercising. I also pay attention to my mental health by performing yoga and practicing meditation.
What do you do if your replacement does not arrive?
In my last position in the ICU at City Hospital, I could not find my replacement one night. It was the end of my long shift, and I was ready to go home. I spoke to my supervisor about it, and we were able to make changes to fit his schedule better, so I would not have to stay late after my shift was over.
Describe a time when there was a miscommunication between you and a teammate. How did you handle it?
One of my coworkers struggled to communicate during the handoff period to begin her shifts. She would often tell me partial information about a patient's status. This leads to confusion and chaos. Eventually, I told her politely that she wasn't giving me proper information at the shift change. She corrected her ways, and even began writing notes for the handoff. I learned the importance of speaking up and being direct at that moment.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello, good morning. My name is Theodore Vincent, one of the registered nurses working in the hospital outpatient department. For verification, can you please tell me your full name?
Good morning, nurse. My full name is Haley Collin.
Haley, you have been scheduled to have a Transoesophageal Echocardiogram next week. Am I right?
Yes, nurse, you are correct.
All right. Have you had the Transoesophageal Echocardiogram before?
No, nurse. I have never had an echocardiogram before, and I am feeling quite nervous.
Your nervousness is quite normal. I will provide basic information to you regarding the test. When you become aware about the test, your nervousness will be settled to a great extent.
That sounds good.
Haley, at first, I will explain the function of Transoesophageal Echocardiogram.
Okay.
In simple words, an echocardiogram uses ultrasound to create pictures of your heart's movement. In case of Transoesophageal Echocardiogram, a specialized probe, containing an ultrasound transducer, or a device, at its tip is passed through your esophagus.
All right.
The test is used to provide the detailed images of the heart, without the hindrance of ribs and the lungs.
Oh, I see.
Major functions of the test is to check the structure of the heart, and how well your heart's valves and chambers are working, to analyze the blood flow.
Fine.
Thus, the test could enable your doctor to plan the surgery, or the treatment required for you.
That's great. Well, nurse, is there anything I should do before the examination?
Yes, of course. Your thoughts are really appreciated. I will provide the outline of pre-transoesophageal echocardiogram requirements.
Fine, nurse.
Most importantly, you should not eat or drink anything for at least 6 hours before the test.
Sure, I will not.
Haley, now I will describe the preparations at the hospital.
Yes, I would like to know about it.
Initially, in the procedure room, the doctor will spray a pain-relieving medication at the back of your throat. This will make the passage of the probe through the throat more comfortable. Also, you will receive a sedative before the procedure to help you relax.
Okay.
A mouth guard will be placed in your mouth to avoid the closure of mouth during the procedure. Other things will be explained to you before the test.
Okay, nurse. That is fine.
Haley, there will be some possible minor discomforts you may experience after the test.
Oh, I see. Nurse, I hope I will feel okay afterward, as I am planning to go out with friends.
Your thoughts are quite sensible. But, as in the test, a tube is being inserted through the throat, slight soreness will be caused. Also, as you are sedated, you may feel drowsiness.
Oh, is it?
Yes, Haley. However, try not to worry. You will be discharged only after conducting the pre-discharge procedures.
That's great.
During the pre-discharge period, you will serve an observation time, and, only after the satisfactory condition, you will be discharged.
I understand that.
During the discharge time, it is mandatory that you have to be accompanied. That is just because of the sedation. And, no driving for 24 hours. So, you should bring someone to accompany you back home after the test. Do you have anyone to accompany you?
I have arranged a friend to come with me. And she will stay with me afterward too.
That's perfect, Haley. Finally, about the test result. The result may take probably 1 to 2 weeks.
Nurse, I really don't want to wait too long for the results.
I can understand your concern, Haley. However, it is the normal duration taken for the scan to be analyzed. Also, a subsequent follow-up appointment with the GP will be arranged.
Okay. That's perfect.
I hope the information provided is clear, and you understand them.
Yes, the information is clear, but I will be glad once the procedure is over.
I understand your situation. Everything will be fine. See you on the day of the test. Take care, Haley.
Thank you. That is the end of your OHT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.